Today is not a good day, especially for us nurses here in the United States. Because today we found out that nurses here, if they commit a mistake, they can be criminally charged now. Yes, I'm talking about one nurse from Tennessee which made a medication error which ended up killing someone. So now she was charged with criminal offenses. This is a very nice topic to discuss, especially for those nurses who have not experienced this kind of technologies back home, or those nurses who are new, so it's best for you to listen and learn from her mistakes. Especially now that we're getting to the point wherein we are advancing for a lot of technologies when it comes to medical field. So I'm sure you guys will experience this in the near future. Either in your workplace or you might go abroad and work in this kind of scenarios. So the question is it right that she was criminally charged? What are the factors that lead for her medication error? What would be the effect on future nurses with regards to her case being criminally charged? Is there anyone else supposed to be liable? This is one of the most talked and most controversial topic now here in the United States. For me, being a nurse working in the medical field, I am actually divided on this matter. I'm not really sure which part I stand on this matter. Before you lay your judgment, let's recap of a little bit of background of what happened. So on that day, RaDonda was working as a float nurse. She's actually a nurse in neuro ICU for 2 years, and during that day, she's working as a float. Every department that needs her, they will just call her and she will be there. Initially, she was supposed to go to the ER to do like a swallow test for a patient. But then someone called from step down department. They asked her to give a medication to a patient down in CT scan. The patient was having some anxiety and could not control it and needed some medications for her to be able to go through the CT scan. Normally, claustrophobia is one of the reasons why these patients are having anxiety. So we give them some medications to help them get through easier. So of course, RaDonda obliged with this request. And during this time, RaDonda has a student with him, or a trainee that who has been a new graduate and is an RN. Okay. So what they did is she received the information that Versed is to be given to a patient down in CT scan. So for her, she went to go to the medication dispensing unit, or they call it Acudose, or sometimes in different places they have the Omnicell or the Pixies. So these are like quite similar. So here she logged in and keying her account and try to look for the profile of the patient that needs the Versed. But unfortunately, the medication that she was trying to find, it's not found on her profile. Usually these have different reasons. One reason is if the medication has not been verified. Okay. Then number two, there's some issues going on with communication between the medication dispensing unit and the EMR, or the electronic medical records. Particularly the MAR, which is the medication administration record. When I say verified, means the medication that has been ordered has been verified by pharmacy. Normally, the process for getting an order or medication is usually the nurse or the doctor will key in the details for the medications on the electronic medical records. So they'll put in, like example, Versed or Midazolam, 10 milligram, give IV, one-time dose. So they will key in on the system. Then, and after which the pharmacy will receive that order, then the pharmacy will try to verify if this medication is good medication for this patient, particularly looking at for allergies, or if the lab values or anything that contradicts for giving this medication to the patient. So in other words, the pharmacy is screening this medication, deeming it to be safe to be given to the patient. Once the pharmacy screens this properly or verifies this will reflect on the medication administration record that the medication is ready to be given and it's like verified. Normally, once it's being shown on the medication administration record that is verified, it normally reflects on the medication dispensing unit, or the Acudose, or the Pixies, or the Omnicell. So it normally does that. There's like a communication between the two of them. Unfortunately, it wasn't happening during the day. One major reason is because Vanderbilt was updating their system, or was transitioning to Epic, or a new electronic medical records system. So Epic, I think Epic is considered one or maybe the best electronic medication record there is. So during this transitioning period to Epic, there's always bound to be problems, like communications between the medication record and the medication dispensing unit, which happened during the day for RaDonda's case. So since there are problems with the system, what RaDonda did is she did an override. Override means you can just try to look for the medication on the system, which is now found the patient's profile. In other places, you're not allowed to do override. You're not. Pharmacy removes these options, particularly for those like medical surgical unit, because these medications are like fatal or not really needed for medical surgical type of cases. But in some cases, for some medications, they allow doing override, particularly during emergency cases, where you don't have the time for you to type in the medication and do the verification, then wait for the verification for the medication on the MAR. So during emergency, you have to do override and get the medication as soon as you can, because time is an essence during emergency, right? So that's what RaDonda did. So she took the medication via overriding. Unfortunately, RaDonda was a little bit distracted during this moment because I think she was talking to her trainee and talking about the swallow test to be done in the emergency room. So for her, she just typed VE, like she was thinking Versed, but she typed VE and she just clicked whatever the first option that came out. And the first option that came out there is Vecuronium, which is a paralytic drug. So that's the medication that she clicked on. So here she didn't read it properly and just click whatever she saw like peripherally, and she just override and she didn't read it properly. Normally, if you're pulling something like a fatal drug or a drug that's really strong, normally there's like a prompt that says that you're pulling a medication that can be fatal or can be damaging to a patient that we need to be given cautiously. So normally that's how the Pyxis or the omnicellular acute-dose usually works. In this case, she was denying that she ever read something like that. And actually, there was a warning that popped up, and she actually just brushed it down and just click on physician available at that time. So there's some few options for you to give a reasons why you override these medications. And for her, she did that. She chose that. So after getting the medication, RaDonda went to the CT scan. Down there, she tried to find a computer for her to scan the medications, like additional verification for her to give the medications safely. Unfortunately, there's no computers or no scanner for her to use in order to verify the patient's wristband by scanning the patient's wristband and scanning the medications. So there was none for her to use. So RaDonda decided just to mix the medication and give the medication to the patient directly without having any hard copy or having any verification on a computer that says this is the medication to be given. And for her, I think she didn't read the bottle properly, so she just mixed everything, prepared, and actually she should have caught something because Vecuronium is prepared by a powdered vial, so you have to mix it with something else. Midazolam is usually like a liquid form, like a vial or ampule, so you don't have to mix it. After RaDonda gave the medication, she went to the primary nurse and gave her the vial. The reason why she gave the vial is because there's a few more ml left inside the vial. And normally, for these kind of medications, when you waste or not use the entire bottle for the medication, you have to waste it. Waste, that's the term. You have to waste it on the system and you have to get someone to verify for you. So during that time, I think they were thinking to do that later on, and normally we do that. We do the wasting a little bit further if we were not busy and all. So ended up RaDonda just went to the ER to do the swallow test or for the patient in the emergency room. Then after a few minutes, code blue was called in the CT scan department, wherein they found the patient not breathing. So upon hearing the code blue, RaDonda went to the CT scan department to make sure it's not her patient. Unfortunately, it is. So during this time, they were giving the code blue and everything. The doctor asked what the medications was being given. They mentioned being given the Versed earlier for the patient. But when the primary nurse checked the plastic bag and with the vial inside on it and realized that the medication was not Versed, instead, Vecuronium was given to that patient. She informed RaDonda, and RaDonda realized that she made a medication error. So what she did was immediately she told the doctor she made a medication error, and this medication was given instead of Versed. So she came up front and told immediately whoever that needs to know about this medication error. She also went to the nursing manager and told her about this. She did not hide this fact, and normally for us, whenever you know that you made something mistake, most of us, I think we have some reservation that we should try to keep this secret. But for RaDonda, I give it to her. She came up front as soon as possible, and she was thinking more of the patient safety rather than her career or rather than her whatever benefit from trying to hide those error. Few minutes after, the patient was able to revive, and they had to bring her back to the ICU. Unfortunately, during that night, the patient passed away. So this was a sad moment for RaDonda because the medication error that she has done has killed the patient. So I think everyone of us, especially those in medical field, will really have this kind of burden, like the guilt that you have done something that killed the patient, which goes against the oath that you have taken. So this is really a heavy thing on your heart, right? So this was not easy for the nurse or for whoever's involved in this case. Then because of this incident, RaDonda was fired on working in Vanderbilt on this day. Then the management for the Vanderbilt tried to cover this up by paying the relatives of the patient who died, mainly the sons. So they gave a cash and doing a settlement. That's the main term. Settlement here in the United States usually happens actually a lot. So money. Okay, so we'll give you money in exchange for not filing a case for this. So they have to do like a paperwork and contract and all those things. When RaDonda found out that she made a mistake, she asked the nurse manager if she needs to document or meaning scan the medication to reflect on the system. As per the manager, you don't have to. That's what she said. So this is where it makes it more interesting for RaDonda. The reason why the manager said that she doesn't have to scan because it will reflect on the AccuDose. It does reflect on the AccuDose that you took out the medication, but it won't reflect that it was given or it was administered to the patient. So that's where the manager made a mistake on. Then on the death certificate of the patient, they wrote there for the diagnosis, for the final diagnosis, is the patient died of natural causes secondary to brain bleed. So that's what they wrote there. Because there was no documentation that a wrong medication was given to the patient which caused the death. Because the nurse manager said, you don't have to document to Nurse RaDonda, right? Then here in the United States, if someone dies like suddenly and not expected, they have to involve the medical examiner. The facilities should report to the medical examiner on what happened. And medical examiner did his investigation and found out that the patient came in or admitted with brain bleed, then died because of brain bleed. So there was no documentation of wrong medication was given. So the medical examiner cleared, meaning no need to do an autopsy for this particular patient. Then because the medical examiner cleared the patient, Vanderbilt management took the opportunity not to report this, that the medication error happened and killed the patient. So because it was clear, they didn't have to report this. That's what they were thinking. Of course, they didn't want to have this like publicized or that one of their nurses or in their facility committed an error. This will cost them money, big lawsuits and everything. So I think management-wise, they will always try to put everything under the rug if they could. So here, they were thinking everything was clear for them. So they were not thinking that there's something else that could come up. Unfortunately, someone tipped the CMS, Center for Medicaid Services. They tipped that something happened to this patient and medical error or medication error was happened that caused the death of a patient. So CMS didn't know about this, and because of the tip, they were triggered to do an investigation. They had to find out if this was really true. And then, in the meantime, Department of Health of Tennessee decided that RaDonda doesn't need to be given a disciplinary action for what she have done. Mainly because it was not done intentionally. So they didn't strip her of her license. So RaDonda was actually able still to work as a RN if she wanted to. But of course, RaDonda still had to pay some fine because of what she did under the Department of Health. Like I said earlier, CMS started doing their investigation. And here, they actually found out that that actually happened. So because of this, they went on to Vanderbilt and told them, we know what you did. It's like the movie that we know what you did last summer. So something like that. So they told Vanderbilt about it. And then through the investigation, Vanderbilt may actually lost some funding coming from the government. So this actually triggered somehow Vanderbilt to do something. I'll explain more what this something is. Might. Okay? Because on February of this year, criminal case was filed against RaDonda. Yes. By who? Do you think it's the family? No, it wasn't the family. It was a lawyer that worked under Vanderbilt before. Allegedly, that's what they were saying. Family didn't want actually to file a lawsuit against RaDonda because they were already at peace. Like they don't want to file any more cases, and Vanderbilt has already paid them. Like they already did the settlement. So they didn't want to run after RaDonda. So here, they were thinking that Vanderbilt hired someone to file a lawsuit against RaDonda so that everything will be shifted to her and not on the Vanderbilt itself. So that's one of the things they were saying about the case, so which makes it more interesting. It's like management is falling down, so we have to do something. Let's find a scapegoat. And that, my friend, is RaDonda. Then on March 27, for the state investigator, during their investigation, they found out that RaDonda committed 10 errors or 10 mistakes for committing the medication error. Then, because of this, Board of Nursing from Tennessee was like pressured to do something about the verdict that they given before. Remember, I said earlier that they didn't want to give RaDonda like a disciplinary action that will cost her license because they were saying it wasn't done intentionally. But because of the state investigation rather, which showed that there are 10 mistakes done by RaDonda, now it's like they're pressured to do something about it. So because of this pressure, they reversed the verdict. So their new verdict was they have to remove RaDonda's license for nursing license, not only for the state of Tennessee, but for the entire US state. So she cannot practice anymore being a registered nurse. Also, she has to pay $60,000 US as a fine. And the three main reasons for this decision was because number one, they said the nurse did not verify the medication, which is true, definitely true. Number two, did not monitor the patient, monitor after giving the medicine. Then number three, did not document an intervention, which I think it is partially fault of the nursing manager who told RaDonda not to do the documentation. So that's the verdict that's a new verdict coming from the Board of Nursing or the Department of Health from Tennessee. So that's basically what happened to this case for RaDonda's case, or what happened to the medication error, and what are the politics involved in this case, which makes it more interesting. So in the next video, let's discuss what are the things they should have done or could have fixed to prevent this error, both coming from RaDonda's case or RaDonda's side, and also from the management side. So if you like this video, please click the like button, subscribe button, and please share to your friends. Again, please comment down below whatever comments, whatever reasons or reactions you have, please comment down below. Or if you do have any more additional info, please comment down below. Okay? Again, I'm Nurse Juan de la Cruz, your RFW nurse. Thank you for watching. God bless. Bye-bye. Stay safe.